Welcome to the MAFEIP Introduction video series, a series designed to help you understand and use the monitoring and assessment framework of the European Innovation Partnership on Active and Healthy Aging, for short, the MAFEIP tool. In this session, you will learn about the model output step and how to interpret the results given. We will first focus on the first two sections: incremental costs and effects, and cost effectiveness. The model output section shows the first results of the analysis based on the data that was input in the previous section. The results used in this section are outcomes from data that is based on the VPH Derrick case study, which can be found on the MAFEIP website. There are two perspectives on the outcomes: a healthcare or societal cost perspective. They may each be viewed by using this button. You may only view results under the societal costs perspective if you have specified societal costs in the previous section. Four types of output are presented. 1. Incremental cost and health-related quality of life per age-gender combination in the target population. 2. Average per person incremental cost and effects. 3. Population level impact. And 4. The impact of the intervention on the probability of the patient specified in the input environment to reside in each of the model states. We will start with the first output under incremental costs and effects, age and gender specific, where two graphs and one table are displayed. For each graph, you can select which plots to display by clicking on the corresponding legend. The first graph shows the incremental costs of your intervention per age and gender of patient. All four plots in this graph depict a curve increasing over time, showing that intervention costs increase as age increases. It can also be seen that incremental costs per person have a negative value. This is interpreted as a good thing, as negative values roughly represent a patient's savings when using the intervention, while positive values roughly represent additional costs the patient pays when using the intervention rather than standard care. The second graph shows the incremental effects by age, or the quality of life years gained or lost by the patient when using your intervention. The plots show the downward curve, indicating that younger patients gain more quality of life years than older patients. Below the two graphs is a table, which can be expanded by clicking the Show Full Table button. The table also differentiates between genders. The table allows the user to view the previous results, i.e., shown by the graphs, in a numerical form. As mentioned before, under incremental costs, negative values may be considered as the savings a patient has when using the intervention. The table here shows that the biggest savings, for example for males, €709.59, accrue to the 65-year-old patients. As you scroll lower to the end of the table, it can be observed that the higher the age, the less the savings are. In this example, at the age of 89 and 90, the costs of the intervention are still lower than that of standard care. The numerical values of the incremental effects also show that there is a decrease in quality of life years as age increases. We now turn our attention into the second set of results under the section Cost Effectiveness. This section displays a small table with three values. 1. The incremental cost, healthcare. 2. The incremental effects. And 3. The incremental cost effectiveness ratio, healthcare. The incremental healthcare cost, here minus 461.41, is the average of incremental cost values per person shown in the previous results. Likewise, the incremental effects result is the average of incremental effects values per person shown previously. The incremental cost effectiveness ratio may either display dominant, dominated, or a specific value. In this example, the result shows dominant. which means that the proposed intervention is better and cheaper than the current standard care. A result of dominant also means that the intervention will always be considered accepted when adopting an investor's point of view. This characteristic of being dominant is also manifested in the cost effectiveness plane. You will instantly know that an intervention is dominant when the ICER point, represented by the blue dot, is located in the lower right quadrant. The cost effectiveness plane can thus be interpreted by first taking note of where the blue ICER dot is, and in which quadrant of the plane this dot is located. If the blue dot is at the upper left quadrant, this means that the proposed intervention is both more expensive as well as worse or less effective than the current care. In this case, the intervention would not be considered accepted in any case. This would also mean that the intervention is dominated. If the blue dot is located in the other two quadrants, that is, the upper right or the lower left quadrant, then it will be useful to compare the location of the blue dot to the willingness to pay, or WTP, plot found here. Below the cost effectiveness plane, you will find the 5 given WTP threshold values. The WTP values are especially important if the blue dot is located in either the upper right plane or the lower right plane. If this is the case, then the intervention needs to be further evaluated based on WTP values. Generally, if the blue dot is located below the WTP threshold plot, then the intervention is accepted. You may select the WTP threshold value most relevant to your target group by ticking the corresponding button. This video presented the MAFEIP tool output model step and how to interpret the results given. Would you like to try out MAFEIP? Contact us at info@mafeip.eu to get assistance and more information. Also, be sure to check out the other videos in this MAFEIP introduction video series. Thank you for watching